Okay guys, so we're going to go through an Achilles taping technique. This is different to the traditional rigid tape Achilles technique, which we find is a bit tough on the Achilles. It likes to have its normal range of motion, the ankle and the Achilles, and so rigid tape sometimes blocks the true motion. So we've got a nice novel technique we use with our Strap It Professional Stretch Band Light. Okay, so otherwise known as the blood tape, which you can rip, so it's hand tearable. Okay, let's show you this technique. This is a 50mm roll. Okay, so what we do is we start sort of like a standard ankle strapping technique. We start around the distal part of the calf, where it starts as the Achilles here. So this is a good area to start. Now, we ask the patient to plantar flex, which means they point their toes in this direction here. So normal ankle position, and we ask them to plantar flex, but I get them then to just relax a bit halfway. That's it there. So ask the patient to hold that position. Now, with the tape, we come down. We can start laterally here. So we start around the lateral aspect of the calcaneum. Okay, we come around into the midfoot, and we apply the tape much like an anchor, and then we head up along the medial aspect of the calcaneum back to where we started. So it's a pretty easy technique, but at the same time very effective. So we come down, and now you can apply the tension through this technique as much as you want, and it will be different per athlete, per sport. So it really is a case of horses for courses. Bigger athletes, you need to rotate and do this many times because it is tearable, which means it will rip if you don't apply a generous amount. Okay, so here we go again, and we may just, for today with Amy, just go around one more time. And we come back up again, rotate around the medial aspect, and you finish up top. Rip the tape, and you can finish with some rigid tape as an anchor, just to lock this off. Come around the side here. So, and then what you find is that the tape, because it does have give, will allow restriction of that movement, but not absolute restriction where there's a true block. You just allow the tape to take some of that energy rather than the Achilles. So for a child, their growth plate, which we talk about Sever's disease, is protected to a point, and in an adult, the Achilles is protected. So allows unloading of those structures. That's our first technique. Now, let's move over to the other side, and this is a different technique. So Achilles technique 1, Achilles technique 2. Okay, so with your second technique, the difference is that with the first one we have the rotation around the Achilles. With the second one, the tension occurs in a cephalad to caudal aspect rather than a rotational. Now let me show you what we do. Okay, so the first thing is to measure up on the patient the size that you want in regards to where you're taking this tape. Now I apply pressure around the calcaneum, and we have a distance similar to our first technique up to that sort of distal aspect of the calf and down towards the midfoot. Okay, so I cut the tape. You can also, just to keep it neat for this technique, you can rip it as well, being hand tearable. Now, we apply a cut down the bottom, and that's about a 2 to 3 centimetre cut. And we do the same for the top. So I'll just separate that out. You can rip a bit more if you like. Just hold that there. Same at the top. You can rip it. It's sometimes a bit tricky, so I like to start the taping technique cut with the scissors, and then you can rip it from there. Okay, so alright, so what we do here, we ask the patient again to go into that plantar flex position. Thanks, Amy. And I'm just going to adjust my tape here just to go down a little bit further than what it was. Okay, here we go. Alright, so rip these ends, the distal ends further, and apply a nice compressive force, and you can see here, come to the side, we're wrapping that around up to the dorsal aspect of the foot. Okay, same with this lateral side. So they're our anchors, and we can apply some rigid tape as well. And here we again apply that stretch, and then we have our anchors. Okay, so that's one tape. Now you can apply 2 or 3 of these, and Amy, if she pulls up there, she'll get that support there. Okay, now as I said, if you want to lock those anchors off, you certainly can with some of the 75mm. Rip that off, and you can lock off the bottom as well. So you can see here we have a more of a directional pull being top to bottom, or careful add to cord, and here it's a rotational with our first technique. So there we go, guys. We've got our one technique over here with our rotational, and then our more linear type of technique here, our Achilles technique number 2. Thanks.